Megan Bradshaw, welcome back to the Tick Bootcamp podcast.
Good to see you, Rich. It's been a while, and I'm so glad to be back on.
It has been, and there's been a lot of development in your life since the last time you were on. You actually had one of the most downloaded episodes of our podcast, and many people have come back because of what you taught about EDS and many other things that were going on in your world. So before we get into your current work, how are you doing? How are you feeling?
I'm doing pretty well. So about 2 years ago, I got back on my feet again. I was really excited that I had the ability to walk again, and I spent about a year and a half traveling and just making up for lost time. I've been rebuilding my energy and my stamina, and I'm really, really grateful that I have this opportunity to enjoy a new lease on life.
That's awesome. So now let's talk about the pivot you made educationally, right? I know you went to one of the big Southern schools.
Yes,
so talk to us
I did.
about that.
So in the midst of my recovery journey, as I was undergoing surgeries, I wanted to return to the classroom because I wanted to figure out what tools I could use to help my community. And so I pursued my master's in public health that I just completed in May at the University of North Carolina at Chapel Hill, Gilling School of Global Public Health.
All right. So you went to one of the big schools,
I did, yes. Right. I'm a Tar Heel.
All right. Congratulations.
Thank you.
And you've also made a pivot in your career now.
I did. And so as I was completing my master's, I got to working with the Center for Lyme Action, which is an organization that I care so deeply about, and I'm really passionate about our mission. And I had been involved with the Center for Lyme Action as an advocate and volunteer for a number of years. And I was really excited when there was the opportunity for me to join the team. And so I was working with them part-time as I was finishing for the last couple of months of my degree. And then when I finished, I came on as our full-time government relations manager. So I am now a full-time registered lobbyist for the federal government. And I like to say I'm the Lyme lobbyist.
That's right. So Megan, talk to us about the Center for Lyme Action, just for those folks who are new to the community. As you know, we have a whole spectrum of people that listen to our podcast, and there are going to be some newbies here who may not be familiar with the organization that most of the more experienced folks are going to be aware of. Already.
Sure. So the Center for Lyme Action is a 501c4 nonprofit organization, and what that means is that we have unrestricted lobbying activities. So 501c3 organizations can only participate in so much lobbying, but this organization was created so that we could really harness the power of the federal government and help to address the issue of tick-borne diseases in the United States. And so what we have is a group of advocates from 47 states that join our efforts. And so we have calls to action throughout the year, and they can help with writing letters to their representatives, asking them to support certain initiatives. But the big thing that we do is something called a fly-in. And what a fly-in is typically it's where groups come to Capitol Hill and they meet with their representatives to talk about a specific issue in a very organized fashion. But we know that our crew really can't be running around the Hill. It would just be really taxing on us physically. And so we want to make this really accessible for everybody. And so our event has been virtual for the last 4 years, and we intend to keep it that way. And what that means for us is that we're able to have really high turnout. So we actually have one of the highest turnouts for all of the different fly-ins that happen on Capitol Hill. So we've started to have this big presence on the Hill now where offices are really recognizing us as the Lyme advocacy group and tick-borne disease advocacy group. And we're starting to really build and foster these relationships, and it's really helping us to make change happen at the federal level.
So talk to us about some of the people you're working with at this organization. I mean, there's some real stars there.
There are.
So let's talk about Bonnie first.
Yeah, let's talk about Bonnie. So Bonnie is one of our co-founders, and Bonnie also co-founded the Bay Area Lyme Foundation. Yes. And so she's been an amazing help to our community. And so we're so appreciative of her efforts and her vision on this. And so what happened is she realized that we needed to get the federal government involved. And so she called her brother, Jeff Crater, who's our other co-founder. Yes. And she knew that Jeff worked in Washington, but wasn't exactly sure what he did, and said, hey, I think we need a lobbyist. Do you know anybody? And turns out Jeff is a lobbyist. And Jeff also has 2 children who have had Lyme disease. Oh. And so this is really personal for him. And so together they joined forces to create this organization. And what we've really been focusing on is the appropriations process. And so what that is we've identified activities that already exist in the federal government that we can help to advocate for additional funding for. So we want to grow those activities because what they do is help get help get us to the outcomes that we need. And so the more money that are invested in these things, the better our community is going to be for it.
Let's talk about that gap in spending between Lyme disease, which is the largest vector-borne disease in the world, and some other diseases. And again, it's not to say that we want to take funding away from anyone else who's been successful in getting funding, but let's talk about that gap and why it's important to do the work that you're doing.
So here's an example that I like to share with people. So other vector-borne diseases are mosquito-borne illnesses. And we know that mosquito-borne illnesses are absolutely a huge global health problem. And West Nile and malaria, for example, are they happen in the United States, but we have maybe about 2,000 cases a year of those, and those are getting upwards of $108,000 on average per patient funding every year, whereas in the United States, 90% of vector-borne diseases are transmitted by ticks, and so we should be allocating more of that funding to focus on the things that are impacting us here at home, and right now it's about $106 on average per patient for NIH funding. And so we're trying to close that gap, and we're certainly making some strides. And but I have to emphasize it's the power of the patient, and grassroots advocacy really makes a difference. So when people come and show up and join our events and do our calls to action, it really helps these elected officials who represent patients know that these are impacting their communities, and they put this higher on their priority list of things to address.
So one of the things I found to be exciting about this last election cycle is Robert Kennedy. Robert Kennedy is the chronic disease czar. I mean, he made that actually the foundation of his campaign. And when he ultimately wound down his campaign and decided to work with the Trump administration or the Trump campaign, he required that a condition of his support was that this administration was going to focus on chronic illnesses. So do you think there's going to be an opportunity here that perhaps we didn't have in the past?
So one thing I want to really emphasize is that our organization is really committed to our values, and one of our values is being bipartisan. And so we know that ticks don't care whether you're a Democrat or a Republican, an independent, or affiliated with any other party. And so
or in any other way.
It doesn't
Tall,
matter.
short,
so we
male,
want
female.
Exactly. So it affects everyone. And so what is really important for us is that we are just trying to get everybody on board here. And so we're looking forward to working with all elected officials, new and old, to try to get this going. And we certainly see that there's an opportunity here. And, I'm hopeful. I think that we'll hopefully be able to work closely with this administration and continue to keep tick-borne diseases at the forefront of their priority list.
So, but one of the things I'm trying to argue, Megan, or at least get your thoughts on, is I think there are some people that have a steeper learning curve, right? And I think one of the things that RFK has suggested or I think demonstrated is that he understands chronic illnesses, and he understands the importance of chronic illnesses, and he understands that policy, federal policy, is a significant issue in the chronic illness arena. And I'm just hoping, because he has a shorter learning curve, that we'll be able to make advances in this community.
Yes, there's certainly hope there, and I think that it's nice to have folks who really champion infection-associated chronic illnesses. But certainly we also have to understand that we have a bureaucracy, and sometimes progress is slow and it takes a little more time. One thing I've learned by talking to lots of federal officials is that it's not entirely up to them, but maybe it all falls on them. And so it's just a matter of trying to work with everyone and get them up to speed and make sure that this is at the top of their priority issue list.
I think that's another piece that we should focus on. There is a suggestion that there is going to be a substantial reduction in the size of the federal government. And I think we have to make sure that when they reduce the size of the federal government, they're not reducing the governmental entities that are going to be significant to people in the vector-borne arena.
Yeah, so I think that it's important to highlight, too, a lot of folks don't realize what role the federal government currently has in tick-borne disease initiatives. So a couple of things that happen right now is, the Cahagan Tick Act was passed in 2019. And what that did was three primary things. One is it helped to develop and implement a vector-borne disease national strategy, which was recently unveiled. The second thing is it creates centers of excellence for vector-borne diseases. So these are at academic institutions and across our country that that focus on vector-borne disease research. And then additionally, it provides states and tribes funding for prevention, detection, and response. And this goes through the CDC. And so we want to have that funding to go there so that they can start to build out bigger programs at the state level so that states can have an entomologist, an epidemiologist, a program and policy person who's focused on tick-borne diseases. And so we are really trying to continue to build that. We've seen in the last couple of years that we're kind of going against the grain in tick-borne diseases, generally speaking, in a time where there's a lot of cuts for health programs across the board. We're really lucky that we're still continuing to move forward and we're getting increases, which is kind of unheard of. But again, power of the patient and grassroots advocacy. So our elected officials are really paying attention to this. But we're excited too about some of the other projects that exist, and we're hoping to continue to help grow them so that our community can have what we need to live well, and we can also prevent other people from joining our community.
So let's build this out a little bit more, and I want to incentivize the folks who are listening and watching this podcast. As you know, we are a patient podcast.
Yes.
You were one of our favorite patients ever to come onto the podcast, and it's exciting to see you in this new role. But I think we need to incentivize patients to participate in this process. So let me give you my thoughts on it, and I'd like you to react to it. So one of the reasons why we have challenges as patients in the tick-borne arena is that many doctors are afraid to treat patients who have Lyme disease. And in large part, they're afraid to treat patients who have Lyme disease because the generally accepted medical practices, which they are going to be comfortable with working within, are generally not available to them for patients who have tick-borne illnesses. As a result, yes, as clinicians, they have the right to treat outliers and use medications off-brand and do those kinds of things, but it takes a brave doctor to do that, and very few doctors are willing to do that, and certainly doctors who are working within the insurance system are not willing to do that. With the work that you're doing and the dollars that will be available for research, when that information, when that research is done, and there's a great deal of research that's been groundbreaking over the last 4 or 5 years. But the work that you're doing and the organization you're doing makes more research dollars available, which then puts physicians in a position where the standard of care and the generally accepted medical practices will be available to them, and they can now treat patients like you who have Lyme disease in a way that they didn't before.
Yes. Yeah. So I think with this too, a big part of this is we're starting to get more messaging from the top. So when these agencies like CDC is prioritizing tick-borne diseases, there's been this national strategy. There's a huge push for this, and we have a lot of people in our corner in these agencies who want to move this forward. And I think that as that messaging continues to trickle down into communities, we're going to see that more providers are aware. They're going to have more tools. They're going to have more resources. They're going to have more information and more protection. And ultimately, it's going to just lead to better patient outcomes, which is what we want at the end of the day.
So let's talk about what patients can do and how they can help you to help themselves.
Yeah. So we, like I said, we have this event called a Fly-In. So we set up meetings with members of Congress so that advocates can meet and share their personal stories, a small portion of their personal story, and talk about how it's impacting them. And then we can ask for these specific funding requests that we're working towards. So like funding those, like the Kahagan Tick Act, for example, is one of the things that we ask for funding for. And so we set up these meetings, and we're hosting this in February. And this is going to be all virtual. We provide all training. So we have a storytelling workshop that we do with our partners at Generation Lyme, which really helps patients to feel comfortable with sharing, this is the worst thing that happened to some people. And it's very overwhelming. And how do you get that into a 30-second elevator pitch? And we want to give you the tools so that you feel comfortable doing that, and you can convey a really impactful messages when you're in those really short meetings. So we have a storytelling workshop. We have training where we do some breakout rooms with some role play, so you can get some practice and you can get a feel for what these meetings are going to go, how they're going to go. And we also have really great team leads. So we have leaders from states who have been experienced advocates who help to guide other advocates through this experience too. And what we do with this is then we have our meetings, and then we follow up and we send them thank you notes. And sometimes that includes a personal story too that maybe you didn't have the chance to expand on in a meeting. And we develop these relationships, and it helps us to increase federal funding. So this is, again, all virtual. You don't have to fly to Washington. You can participate from the comfort of your couch. When I started doing this a couple of years ago as an advocate, I had pajamas on, I was on my couch, I had my IV pole. Like, this is the condition that I was in. And so we want patients to know what we're meeting you where you're at. And even if you're not doing well, if it's a tough health day, if you're not up for speaking, if you don't feel comfortable sharing your story, that's okay. if you just want to show up and have your camera off and your microphone off, for you to be there is really, really compelling. We have advocates too who help share each other's stories. We have some folks who maybe are having a poor health day, and they'll send a little message to a friend who's in their meeting, and they're going to say, hey, I'm going to share on behalf of Rich because he's having a poor health day, but I think it's important for you to hear how this has impacted his life. And so we set this up and we give you all the tools and the resources. And I know for me, I started as a patient. I was an advocate, and I got really involved with this, and I started volunteering with the organization. So I was not a professional lobbyist before this. This is a totally second career for me. But
that's really cool.
For me, I have really found that being an advocate and sharing my story and helping to talk about the things that should be in place so that other people don't have to experience this, it's helped me in my own healing journey. It helps me to reclaim a little bit of what's been taken from me. And I talk to advocates day in and day out who also feel that same way when they have these opportunities to help reclaim a little bit of what's been taken from them. And so I really hope that patients will participate in the fly-in. And if you're not up for joining meetings and you still want to get involved, that's okay. We have other ways. We need some help behind the scenes with forms. That's a big part of what we do is we have to fill out a form for every single ask that we have, which is about 5 a year to every office that we meet with. So these are thousands of forms. And so we need a lot of folks to help crank those out. And we need folks to help us with recruiting volunteers and sharing information about the event. There's a lot of different ways to get involved. And so we want people to know that, if you're passionate about this, if you want to get plugged in, please reach out to me. I'd love to talk with you. I'd love to introduce you to the team lead from your state and figure out how we can help get you dialed in. But this is a volunteer-based organization, and our advocates are incredible people. I feel so fortunate that I get to support my own patient community. And I really look forward to growing our advocate network and continuing to make big changes happen. We have a lot of momentum, and we have to capitalize on it.
Yeah, so to sum this up, Megan, there are three different things that I think you've talked about, which I think we should highlight as a way of winding down. The first reason folks should participate in this event is because it will put them in a position where they are substantially more likely to receive better patient care.
Correct.
Where their doctors will be safer caring for them at the level they deserve to be cared for. The second reason folks should consider doing this is it's a way of plugging yourself into a community of really kind people, and it will open up your social circle in a way that it hadn't been opened up before. So many people who are suffering from Lyme disease are isolated, and their social circle becomes very small, and this is a way of expanding that circle. And as somebody who's been working with this community for the last 5 years, you will not find a kinder group of people, right?
You will not.
And the third, and I think the most important, if I could argue, and you really, I think, really brilliantly just define that, is many folks in this community lose their purpose, right? And because you lose your purpose and you lose your rudder, it makes it very difficult to believe that you can heal. And when you lose the ability to believe that you can heal, it makes it difficult to heal. And this is a really beautiful way of finding the purpose and the reason why you're on this journey, and will help you to heal. So I want to strongly urge folks in this community to join you and your organization with this fly-in because there's just a lot in it for them.
Absolutely. So I really am hopeful that we'll be growing this year. As I said, we have one of the highest turnouts for Hill Days, which is amazing. But I know that we have tens of thousands of patients who are just like me, who, maybe you're in the thick of it and you're looking for some glimmer of hope. And I hope that you'll join the fly-in and get plugged in. You'll meet some really wonderful people who are in your own state, and you can build some relationships with those folks. I've seen some really amazing friendships flourish from this because people are getting connected with others in their community who understand firsthand. And so I'm looking forward to seeing where we can go. I know that there's going to be some great things on the horizon next year, and we're looking forward to working together. This is an issue that obviously impacts all of us, and our efforts are going to help our broader community. And so we look forward to bringing in all of the different advocates and organizations that exist and kind of working together as a team so that we can just influence the federal government to help take action and mitigate the burden of tick-borne diseases on America.
So Megan, the purpose of Tick Boot Camp is to create a platform where models are available to folks in the community so that they can find someone that they can connect with and that they can use as a vehicle for going on their healing journey. And I can't think of anyone we've ever interviewed that's a better model than you. So thank you for all that you're doing.
Rich.
We really admire you.
It's really
and all
kind
the
of
work
you
that
to
you've
say.
done. And I strongly want to encourage folks in this community to model Megan.
Thank you. That's really kind of you to say. I hope other patients will get plugged in, whether it's with us or other organizations, and find a way to just build your own community here and find these connections, and also just reclaim a little bit of what's been taken. It's a really powerful thing.
So Meg, can we just finish this interview up by giving us the date of the fly-in and the dates if you've already established the trainings?
So we have our storytelling workshop with Generation Lyme is going to be on Monday, February 10th at 8 p.m. Eastern. And then we have a training session that Wednesday, the 12th at 3 p.m. Eastern. That's going to be an extended training for new advocates and those who need additional help. And then on Thursday, the 13th, we have a fast-tracked 1 hour training. So this may be for experienced advocates at 4 p.m. Eastern. And at 8 p.m. Eastern, we're also hosting a training for healthcare providers. So if you're a healthcare provider and you're interested in getting involved, we would really love to have you. It's really helpful to hear that perspective too, of what they're seeing in their community and what resources are needed to help address the problem from a professional standpoint. So we're hosting this at 8 p.m. on Thursday, February 13th, just so that you don't have to take away from time in the clinic with patients. And then we have our opening session is on Tuesday, February 18th at 3 p.m. Eastern. And then on February 19th, we encourage everyone to block off the entire day. While you won't have meetings all day long, we want to make sure that you're available for the meetings that we do get scheduled for you. You'll have at least 3 meetings. So with your 2 senators and your representative, these are about 30 minutes apiece. And those will take place on Wednesday, February 19th. Registration is now open. So if you go on our website, centerforlymeaction.org, it's under the events page. And we hope that you'll follow us on Facebook, Twitter, Instagram. We're on LinkedIn and Threads. So we're on all social media. So we'll hope you'll give us a follow and stay in the loop about all of the different things that we have coming down the pipeline we're really excited about.
Thank you, Megan.
Thank you.